Hello, my name is Megan Dulong, and I'm a current Master of Occupational Therapy student at Bay Path University. Throughout our coursework, we've discussed what it means to be a professional and how to develop clinical expertise. I will delve deeper into that here.
Hello, my name is Jessica Patswell, and I'm also a Master's of Occupational Therapy student at Bay Path University. I will be discussing the different types of reasoning processing that an occupational therapist can use. In addition to that, I will be discussing Driscoll's reflective cycle, the experiences of OT students in their fieldwork placements, and a personal reflection.
So, to begin, I would like to focus on what an expert is. We all have our own opinions of what we consider an expert. And before engaging in our class lecture, I considered an expert to be an individual who's competent, confident, and knowledgeable in their content area. I also considered an expert to be one who has worked in their field for a long time. But after completing the lecture and readings assigned to our class, my concept of an expert has expanded to include additional qualities. According to Patricia Leverdier, an expert is one who can think flexibly and effectively when presented with an unpredicted change in context. Experts constantly engage in the reflective process in order to continuously do better for their clients and as themselves as clinicians. They reflect on what worked, what didn't work, and how they can improve for next time. Experts present with a level of skill and tacit knowledge of concepts that allow them to think about many things quickly as well as simultaneously. And this allows for the adaptability and flexibility that I just mentioned.
The 7 general types of reasoning are specific, procedural, pragmatic, narrative, interactive, ethical, and conditional. According to Barbara A. Boyd-Schell, in the article entitled Professional Reasoning in Practice, scientific reasoning focuses on data, diagnosis, and what practitioners know about the symptoms a client is experiencing. Scientific reasoning can also be referred to as treatment planning. Procedural reasoning is the knowledge of occupational therapy interventions themselves. A therapist considers and uses intervention routines for the client's identified condition. This can be science-based or reflect the habits and culture of the intervention setting. Procedural reasoning can be in the form of an interview, observation of the client, performing a task, or formal evaluations using standardized measures. Pragmatic reasoning involves the OT making decisions in light of the reality in the context we are working in. This includes practice and personal context as the 2 perspectives. For instance, in that article written by Schell, there was a case example about an OT who planned an intervention treatment that involved self-care activities. But when she arrived to the client's room for the treatment session, she quickly learned that the client had already completed all the self-care tasks with a nurse. Therefore, she needed to come up with an alternative treatment session on the spot. Using her pragmatic reasoning, the OT came up with the idea to use a flower vase in the client's room as a therapy tool instead. The narrative reasoning processing focuses on how the client's challenges affect the individual as a whole, and it is important to appreciate the client's unique story by making treatment decisions on what is important to the client. The interactive reasoning process focuses on doing activities with the client as opposed to doing something to the client. This can happen both consciously and automatically. The thinking with interactive reasoning is directed towards positive interpersonal relationships with clients, which encourages collaborative problem identification and problem solving. Questions such as, how should I prioritize my caseload? And, are the risks of therapy worth the benefits? Fall under ethical reasoning. This involves the OT following standards, codes of ethics, and the guidelines of the particular facility that he or she is in. This can create tension as the OT attempts to figure out the right thing to do when faced with the principles, risks, and benefits of therapy services for a particular client. When using conditional reasoning, the OT is thinking about not only how the client is presenting today, but how that client has been in the past and how their future is impacted as well. This is unique to every individual. With conditional reasoning, the interventions are continuously modified in response to the changing conditions and context in which the therapy is occurring.
Individuals do not just become experts overnight. Several levels of reasoning exist that each represent the skill levels of the developing clinician. The first level of reasoning is a novice, followed by advanced beginner, competent, proficient, and finally, expert. Not all people progress through these levels at the same rate. Though expertise is often associated with years of experience, progression through these levels depends largely on the individual's personality, learning style, work ethic, and reflective process. What's important is that an individual is constantly striving to progress in a forward direction. So Barbara Boyd-Schell describes the levels of reasoning in more detail. So for the novice clinician, the practitioner relies largely on textbook knowledge and schooling in making clinical decisions. They think slowly in a step-by-step manner so as to make more careful decisions. The advanced beginner begins to incorporate more clinical experience into reasoning, as well as textbook-level treatments, but may still rely largely on their knowledge from schooling as they haven't had as much time in the field. A competent practitioner develops skills that come more automatically. They're able to plan more effectively, but they may lack the flexibility and adaptability of more skilled clinicians. External sources may be needed for treatment ideas, but these are not relied upon as heavily as the novice or as the advanced beginner. The proficient practitioner is more skilled and sophisticated in their reasoning. They possess a greater ability to consider situations holistically and with greater mental flexibility. The expert practitioner typically has anywhere from 5 to 10 years of experience, and these practitioners rely on tacit knowledge and quick intuition. They possess a high level of flexibility, adaptability, and skill in addressing many areas of concern.
Previously, Megan discussed the novice level of reasoning and the expert level of reasoning. In order to reach that expert level of reasoning, practitioners must constantly be reflecting on their actions. The importance of reflection is supported in Patricia Lavender's article entitled Using Reflection to Advance Professional Expertise, A Novice to Expert Trajectory. The core elements of a successful reflective practice are described as the 4 C's, which stand for continuous, connected, challenging, and contextualized. Lavender discusses Driscoll and Tess' article entitled The Potential of Reflective Practice to Develop Individual Orthopedic Nurse Practitioners and Their Practice, which includes 3 questions about Driscoll's reflective cycle. These 3 questions are, what happened, what can I learn from this experience, and what can I do differently in the future? This cycle has been adjusted to add 2 more important questions, which are, how might I organize and prioritize my professional development planning, and is there research that can guide my knowledge and skill acquisition? These questions were added to enable the reflective practitioner to challenge practice assumptions, explore new ideas and approaches, promote practice environment, and link practice to theory.
An additional article that supports knowledge of becoming a developing professional is Donna Wooster's exploratory study of web-based supports for occupational therapy students during Level 2 fieldwork. Most occupational therapy students' desire is to become successful clinicians in this field of practice. For many, the first step in becoming a clinician is going out on Level 2 fieldwork. As daunting as fieldwork may seem, many supports do exist in aiding students in having successful and beneficial fieldwork experiences. This article describes a study conducted that highlights the benefits to communicating with faculty and classmates during students' time out on fieldwork. This study found that students who participated in asynchronous web-based mentoring while participating in Level 2 fieldwork scored higher in their fieldwork performance evaluations than those who did not participate in web-based mentoring. This mentoring included discussions surrounding treatment ideas, personal experiences at fieldwork sites, sharing of evidence-based research and other clinical information, as well as positive verbal and written affirmations for classmates in supporting them in their endeavors in fieldwork. As a student preparing to embark on Level 2 fieldwork, it is important to maintain contact and communication with faculty and peers alike in order to make the most of developing clinical expertise. The sharing of ideas and knowledge contributes to developing sought-after clinical skills and allows one to stay abreast of the latest evidence-based research.
Another source of information that helped further my learning on being a professional is an article entitled Experiences of Occupational Therapy Students in the First Fieldwork Education, a Qualitative Study. The authors of the article discuss that a core part of all occupational therapy curriculums around the world is fieldwork education. A study was conducted to explore occupational therapy students' experiences and their fieldwork. This study was conducted by interviewing 16 occupational therapy students who had passed their first semester of fieldwork education. With extensive analysis of the interviews, there were 3 common themes identified amongst individuals. These 3 themes were the importance of supervisor management, challenges with the current curriculum, and challenges within the educational environment. While reading this article, I imagined myself as a Level 2 intern in a fieldwork placement where I had those same 3 issues. In order to overcome these challenges, I could practice using the various professional skills that I have learned in this module. By having an understanding of these professional reasoning skills, I will feel confident in having discussions with my supervisor to support my learning, ask questions when I feel challenged by the curriculum, and learn how to adapt any adjustments made in the educational environment. I understand that as a novice learner in fieldwork, I rely more on the information in my textbooks as opposed to prior experiences, which I lack, and that is okay. One of the occupational therapy students in the study claimed that she was unsure of how to talk to the patients, and the supervisors did not provide information on how to talk to the patients either. When I speak to future clients, I will use interactive reasoning to form a bond with a client and use other type of reasoning skills I spoke about earlier in order to enhance my connection with the client, along with making the client feel comfortable and providing an overall client-centered treatment session.
After engaging in class lectures and readings, I have developed a greater appreciation for the opportunities Level 2 fieldwork provides. While I always recognized this as an important time to develop clinical skills, I had not previously considered that I could also provide a learning experience for my clinical instructor. The Level 2 intern has the ability to act as a liaison between academic institutions and current practice settings. In this way, the intern has the ability to not only learn and develop clinical skills, but also to teach and provide knowledge to those already working in the field, which I thought was very interesting. This lecture also provided me with a new outlook on the benefits to becoming a new grad practitioner. I've previously worked as a home visitor right out of college, and in this role, I was particularly unsure of myself in the fact that I was young and I have no children, yet I was teaching child development and parenting skills to individuals with many children who were much older than me. And though I learned to advocate for myself and my qualifications and competence in this role, the idea of being a practitioner fresh out of school is still something that I get nervous about. The idea that having come right from school and possessing the most current and up-to-date information about occupational therapy is a comforting thought, however. This is a reminder to remain confident in my abilities as a novice practitioner when I go out into the actual fieldwork and in the clinical field. Expertise is not something that necessarily comes with years in a practice setting. One actually needs to put in effort and work to become an expert. And I suppose I always understood this concept, but the lecture materials made it quite explicit that the way to developing clinical expertise is through continuous professional reasoning and research into current evidence-based practice. The skills of a practitioner are developed over many, many years of calculated thought and reflection, and this will continue to be in the back of my mind as I progress through my career as an OT. Occupational therapists make intervention decisions by engaging in a process of reflection that considers the past, the present, and the future. I personally went into the field of OT because I had a great appreciation, and still do, for the holistic nature of therapy. I think this is so important as well as necessary in developing effective treatment interventions. These lectures and readings truly outline the ways in which occupational therapists engage in intervention planning. Therapy is not only holistic in the sense of considering the many components of our clients, but it's also holistic in the sense of reflective thinking as a practitioner as well. By considering what happened, what I can learn, and how I can make changes to my practice, I am setting myself up to becoming a lifelong learner and a clinician who strives to be better as I advance forward in my career.
Through my engagement in this module's readings and assignments, I feel much more prepared in my role as a Level 2 fieldwork student. One of the key points that stuck with me the most is that being a novice learner is okay for me in the early stages of my experiences as an OT. I oftentimes ask myself, what if I don't have anyone to talk to about questions I have as an OT? What if I make a mistake? Or what if my client doesn't like me? I will always have some worries, but now I feel confident in my ability to use different types of reasoning and reflecting in order to interact with others in a way that works best for the client and myself. I'm still amazed by how many different types of reasoning there are, and how they are intertwined throughout treatment sessions. While making intervention decisions as a new grad practitioner, I will refer back to my prior knowledge, the client's current needs and goals, along with what I can do now to help the client have a future where they feel independent as possible. Although the estimated time for how long it takes to be an expert is unique to every individual, it is helpful to know that it usually takes 3 to 5 years to reach that level of expertise. As a new graduate, I may feel pressured to be an expert, but I understand that being an expert takes time. While reading Jarrett Wolski's article entitled Using Evidence for a Successful Fieldwork Experience, I learned about the different ways I can stay up to date on the latest evidence-based research. I spend a lot of time driving, and I oftentimes get tired of listening to the same music and the same podcasts, so I'd like to incorporate listening to OT-related podcasts into my everyday lifestyle. This can help give me ideas on my interventions for my future clients and keep me up to date on the newest topics in OT. I can also subscribe to receive the monthly copy of the American Occupational Therapy Association magazine to assist me in learning the newest information. While making intervention decisions as an OT, it is important that they don't only focus on past information, current information, or what the future holds. Rather, I reflect on all three, the past, the current, and the future, when making intervention decisions. Reflecting is something that I've always enjoyed doing. It is reassuring for me to learn about how crucial reflection is as a practitioner in order to be an expert. During my Level 1 fieldwork, I kept a journal that I wrote about my observations, and I plan to do that again. I am looking forward to all that I will learn as an occupational therapist, and am grateful for the learning process that I've been a part of so far. The content within this module has helped bring me one step closer to being a registered occupational therapist.
Thank you for listening.
And we hope you enjoyed our TED Talk.